different things that they expect from us as anesthesiologists. Number one is competency. The fact is that I think that there needs to be somebody there who they can feel comfortable and confident that they're going to do the right thing for the patients and that they can provide safe care and consistent care for the patients. So that's the first piece. Secondly is the ability to be flexible to some extent, the ability to be able to understand what the situation is about and what to do, but to be able to be flexible, to be adaptable to that situation and understand what their needs are and maybe be able to accommodate them in the way that you can best do that yourself. So those are probably the two biggest things that they're looking for in anesthesiologists, the ability to be there when they need you and to be able to provide care for them when, in a safe and efficient manner when they need. I think they're expecting somebody who can take good care of them and that they can feel they can put their life in your hands, basically. They're going to go to sleep or they're going to be sedated and they're not going to be in control. So they need to have somebody they can feel comfortable with immediately. Our interactions with patients are very, very short. We basically meet our patients a few minutes beforehand, and you have to be able to establish a degree of trust, a relationship between you and the patient that they feel as though this guy or this gal is good enough for me to be able to comfortable that I'm going to give them my life and let them take care of me for the next hour or two. And that's a skill that you learn over time about how to make people feel comfortable, and it's something that I think is really critical. Otherwise, I think if patients feel as though the person who's going to take care of them isn't up to snuff, then there'd be big issues at that point. I think they're looking for basically a team player, basically a department who's able to help the whole hospital as a whole, as a team player, basically be able to work with them in the initiatives and the goals that the hospitals are moving towards, as well as somebody who's able to provide the services overall that are needed on a day-to-day basis. So it's both sort of a short-term and a long-term strategy.